It is my great privilege and honor to introduce Donna Shalala, who probably needs no introduction in this room. I could talk about her and her accomplishments for the next couple of hours, but I'll leave you with these highlights. She's a trustee professor of political science and health policy at the University of Miami, a former president of the University of Miami, a former secretary of the United States Health and Human Services. She is a Presidential Medal of Freedom winner. She is a member of multiple national academies. So with that, I'm going to leave you in Donna's hands.
Let me introduce Vanessa Kerry, the co-founder and CEO of Seed Global Health. She also is a professor at Harvard Medical School.
Not a professor yet.
Well, not a professor, assistant professor.
We're working on it.
We're working on it?
Yeah.
That's right. I can give you 10 right now.
Let's chat.
Take it.
That's helping. Thank you.
Ambassador Debbie Birx.
Hi.
Who runs PEPFAR. She's got long titles, but she runs PEPFAR, and everybody knows PEPFAR. Patty Garcia, the former Minister of Health of Peru.
This is me.
Yeah. Geeta Gupta, who's a senior fellow at the UN Foundation, and I think many of you met Geeta before. Joia Mukherjee. I actually know someone with that last name. Chief Medical Officer of Partners in Health. This is our panel, and the topic is how to become a change agent in global health. And I actually want to make sure that we talk to people under 40 in the audience. The rest of you can whisper to them any advice you have about how to become a change agent. But I think it's time that we talk to the young people in the audience, because they're wondering how we got where we are. So let me start down here and talk a little about your career. And then if you had to give advice to a 30-year-old out there, what would you tell them about being a change agent?
Yeah, great. Thank you, Donna. So I'm Joia Mukherjee, and I have been at Partners in Health for 18 years and on the faculty at Harvard for 20. Seems long, but it goes by in a blink of an eye. And I really got started because I was an activist and because I had great mentors, including Pat Walker, who's in the audience. But, I really was an activist. I saw suffering firsthand as a kid going to India, my dad's home country, and it just seemed really unjust. And as I started to work in Africa and later Haiti, et cetera, it didn't make any sense that poor people, particularly people of color, did not get medical treatment. Because back in that time, in the 90s, all you could do was vaccination, vitamin A, but no medical treatment, no hospitals, no x-rays, certainly no CAT scans. And that just seemed crazy. And at that time, in the sort of early 90s, the AIDS movement was starting. And it seemed similarly, a group of people, mostly people living with AIDS, incensed that all human beings didn't have access to medical care. So naturally, I became an AIDS activist and really started trying to agitate for people all over the world getting AIDS treatment, but really as a way to say medical treatment. Because if you have AIDS treatment, then you need a lab, then you need nurses and doctors and hospitals and x-rays. And so it was just a foot in the door toward the right to health. So my advice, and so I've been part of the AIDS movement. I've been part of building health systems in more than a dozen countries, and led a really amazing organization where I'm mentor to many thousands of young people all over the world. And the advice I give is take the risks you can when you can. So don't worry about degrees or trajectory. And maybe this is a bit different than the advice you got about thinking of the end goal. That's important. But if you see an opportunity to make change, even if you think it's a bit risky or if it costs you some money, or really do that. Because for me, taking time out of my residency, medical school, et cetera, was the thing that put me on this trajectory. And most everybody was against it at the time.
Thank you. Geeta, you and I are the only two up here who isn't a doc. You're a social psychologist,
That's
if I remember
right.
correctly.
That's right.
What's your advice?
Well, I should say that my entire education and early career was in India. I've spent over 30 years on issues related to gender and development, with a focus on girls and women. And I've often said that growing up in India, if you're educated and you don't come away from that experience with an anger in your belly, there's something desperately wrong with you. Because the inequities and the indignities and the injustices that girls and women face on a daily basis are so visible and so apparent that even I, though I grew up in a very gender equitable family with very progressive parents and a mother who was a powerhouse, an aunt who was a powerhouse, and professional women, I noticed the inequities around me and experienced, in going to school and college, the daily assault on me as on my physical being, just trying to get to college and use public transportation every day. So it seemed a natural sort of progression then to pick and try and understand what happens to women in India. Why is it that our society is so inequitable with regard to gender? And initially, that led me down the path of research. I did, as a college student, participate in the women's movement and was very active. Realized very quickly that just shouting for and asking for change didn't work unless you could back that up with data and unless you could back that up with clear, practical solutions. And so chose to go the route of doing my PhD on trying to understand women's lives and why is it that they made the choices they made when they had to manage both work and home, what suffered as a result. And this I'm talking about in the 80s. I'm really, really old. So I'm talking, this was 83, 84, when I was doing my PhD. And I can tell you that I was startled to see how repeatedly women who were both in service professions as well and professionals as well as women who were in secretarial positions or just stay-at-home moms used the word adjust. A big part of their socialization as women is things will happen to you, but you just adjust. And in fact, in Kannada, where I did my PhD in Bangalore, there is no Kannada word that I know of for adjust, and they use the English word, and they say it with an Indian accent. So it is salpa adjust madi. Just adjust a little bit, please. And whether that's you in a bus, in a crowded, overcrowded bus that stops at the next bus stop and the conductor takes 10 more people even though you're packed like sardines and then says, adjust, salpa adjust. It's that concept. So women's socialization is about just adjust a little, no skin off your back.
Thank you.
And that's the passion that motivated me. And I would say that what I think succeeds in career-wise is not to say no to opportunities. Like you said, my mother used to often say the Yogi Berra comment of when faced with a fork in the road, take it. Don't say no. So a lot of young people have very definite paths ahead of them. You know, I'll do this, then I'll do that. That'll take me here, that'll take me there. That's not how life works out. It's never linear. And you'll be surprised at where life will take you and how it'll all ultimately add up. So take it, feel the passion and take that passion forward, back it up with data when you can, and back it up with human stories.
Great. Two very different careers. Vanessa, you actually started an organization. Why don't you talk a little about your...
So, you know, I did start an organization. I never thought I would do that. I grew up in a house of public service and grew up with parents who really believe that you fight for people who are voiceless, and a mother who talked about depression in the late 1980s, early 90s when no one else was talking about it, and had this experience. And so when I went to medical school, I was a dorky kid who always wanted to be a doctor. I knew I needed to have a career that was involved in some way beyond, you know, that was trying to figure out some bigger global problem. And I think just to speak quickly to the piece about an unconventional path as I get to how I started an organization, because it was actually quite accidental. You know, I took 6 years to go through medical school. I took 2 years before I went to medical school, and I worked on a ranch and for a photographer and just totally did something different. And I did that because I needed the time and space before I went into what I thought was going to be a very linear path. And things happened along the way in medical school, and I took 6 years through medical school, and then I went into my residency. And in residency, I really thought I was going to be a cardiologist. applied, dropped out a week before the match closed because I got offered a job in global health that I didn't think I could turn down. And then that job sort of disappeared. And then when I found myself sort of at this brink of ending my residency and figuring out what the next step was, I started to get involved in a grassroots movement to help change this medical tourism phenomenon of people going abroad, giving care, leaving, but not necessarily actually investing in the partners and leaving any kind of legacy behind. And that just didn't make sense to me. There's a huge amount of need, a lot of really smart people that just needed to be empowered to be able to do more of what they wanted. And there needed to be a way to do that. And yet there's a huge amount of people interested in doing global health here in the United States and had no concrete programs or pathways to do it. I saw my friends cobbling together careers of working nights for 9 months. For 3 months, so that they could go spend 9 months abroad and not even get the full work they wanted to have done, and they carried debt, and it all just didn't seem to make sense. So there had to be a better solution. I'm an optimist about government. So I believed that we could challenge our government to help create a program that would be able to send these energetic young Americans or old Americans, whichever, to go abroad and to be able to give their services in a structured program that had longevity, sustainability, that built on itself year after year and really, really partnered with folks on the ground to meet their priorities and their needs and to empower a generation of doctors, nurses, midwives in these countries to be able to be their own leaders and agents of change. And so we went to a forum of Peace Corps directors, and we just raised our hand from the rafters and just asked the anonymous question, what do you think about the Peace Corps sending doctors, nurses abroad to be medical nursing educators, to teach and train? And the answer was yes. And we seized upon that, and we went forth, and we said, great, okay, can you start this program? And they said, well, we can't do it alone. And I naively said, great, well, okay, I'll just start a nonprofit to help you do it. And so I filed some papers, and then all of a sudden, we have blown up into a $6.5 million organization. We do a lot more work than just the partnership we created with the government. We are now sent 191 Americans to serve in 5 countries at 34 sites, and we've trained over 10,000 doctors, nurses, and midwives in 5 countries in the last 4 years.
So, persistence, right?
Persistence, but I've given up my medical career as of 6 months ago, at least in the way that I thought I was going to do it. I was a critical care doctor. I now spend a couple days a month at an immigrant clinic in north of Boston, and I draw a huge satisfaction out of that. But it's an evolution. And I'm learning a lot to be humble. I'm learning to say about what I can do and how much I can't do. I have 2 little kids. And learning to say yes and to be forgiving and to just keep knowing that we have to fight for what is fundamentally right no matter what is happening and find the community to do that, and it will be okay in some way.
Good for you. That was easy. Patty.
Okay,
Now,
well,
you've been a minister of health, so how'd you get there?
well, let me start by asking, how many people from Latin America are here?
I live in Miami. Does that count?
No, it doesn't count. It doesn't count. So, you're Egyptian, come on. Well, but anyway, I was talking with Michelle. Somebody raised the point that there were not enough Latin Americans. But here we are, guys, okay? Yeah. Here we are. And actually, I want to start my story with a picture, if I can.
Please.
Okay? So, since I remember, and I have to tell you, I haven't always seen myself as a thinker looking for ways of changing the world, okay? And you see, look at my face. And actually, one of my role models was my grandmother. My grandmother, she was Andean, she was Indian, and she was a traditional healer. She was a chamana. And she taught me, since I was 5 years old, how to cure passing the egg, passing the guinea pig, the cuy, we call it, how to really wash your sorrows and your diseases with flowers. But more importantly, that it was so important to listen to people. And so I started to think that I wanted to be like her. But then I got very sick, 8 months in bed, and I learned that there were doctors, and actually I wanted to be a doctor. But I also wanted to be a hero, okay, a superhero, among a world of men, okay? At that point, I didn't know that the way to do that was to do public health and global health. Until I met this guy that probably you know, King Holmes. Actually, he told me, why don't you do some public health, just for fun? And then I started doing public health research. I went into academia. I was the dean of the School of Public Health at Cayetano Heredia University in my university in Peru, which is a very renowned university. And then I was invited last year to be the Minister of Health of Peru. I received a phone call from the president. I thought it was a joke, actually. He's like, well, I'm the president, and are you Patty Garcia? Yes, okay, I would like you to come to my home. I said, like, oh my God. But anyway, I saw the opportunity. I talked with him, and I got it. And actually, I have to tell you that that was one of the important, I don't know how to change this, but if you can. Okay? So that was one of the days that I really celebrated because I thought that was the opportunity to make a difference in my country. Although I knew that the average time of a minister in my country is about 6 months. Okay? But I said, I'm going to try to do things. And actually, it was really tough. I have to tell you, it was really tough. There were lots of politics and a lot of corruption. And I put like 35 people in jail. Okay? And I know that that has something to do with the whole situation and with a lot of opposition in the Congress. Still, I was able to do lots of things. We increased the coverage of HPV vaccination, over 85% average in the country. We introduced molecular testing for HPV, with women helping other women to do self-testing and sending messages by SMS for the results. We introduced telemedicine, telemammography, electronic medical records, regulations for healthy food, and I can keep going. But the situation was that around the last week of September, the whole cabinet of ministers were forced to resign. And so I'm back at the university, but I will keep working for the health of my country and the rest of the world. And actually, I want to give you, because the thing is not only to tell the story, but what I think I learned and what I think, because I still will do it again, even if it was for a year and 2 months. So I was counting the months, okay? And even though that was the first time I felt discriminated by the medical unions that were most men, and what it says there is like, we make ministers, women ministers, we make them fired, okay? And actually, I'm the third one, so they fired the previous two. But actually, I was able to work with them. We increased the budget. I increased the budget for next year, for the next minister, about 20% in health. Increasing also the salaries for the 17 categories of health workers, discussing with the Ministry of Finance on issues that had to do with productivity. So I'm very proud of that. But so let me give you my top 5, because I know that my time goes, and as a Latin, I usually talk too much. So these are my top 5 priorities for the young people, okay? And you will see that we are sharing things that everybody has said somehow at some point. First of all, I think you have to work with passion. Passion is something that you have to put in every single thing that you do, and you will be able to do things. And you have to love what you do. And I do love public health and global health. And so that's one thing. The second thing, do your best to create opportunities or to use the opportunities that life gives you. So that's what I jump into the Ministry of Health. Although everybody was telling me that I was crazy, and I'd say like I'm a passionate crazy for public health. Then fight against your own fears. Okay, we're humans, but fight against those. But raise your eyes and raise your voice when you need it. And that's something that I learned talking with the College of Physicians and with the unions, medical unions, that were complaining why I was putting nurses and midwives in director positions. And actually I did it because they deserve it and they could do it. Then be honest, okay? And that's something that we need a lot in my country and I guess in all the world. And finally, be perseverant. And you were saying that, some people were saying that. Be perseverant, but also have patience, because changes may take time.
Thank you.
Thank you.
You know, Patty, the United States has an opening for a Minister of Health.
I will take the opportunity. tell the president that now when I go back.
Debbie, you've had an interesting career, mostly within major anchor institutions in our country. So talk a little about your career.
Well, this has been brilliant. I've learned a lot from these 4 women already, and of course from you, Donna. And I guess I'm not going to try to repeat anything that they've said because it's been so extraordinary. So I'll start out by talking about I'm really a failure in my family, and I think that's really important to recognize. I grew up in a family of mathematicians and electrical engineers. I had 2 older brothers, both of them nuclear physics. And so when I went to college, I said, okay, well, I got to compete somehow. So the closest I could get was physical chemistry and mathematics. And I realized in my years in college that I really didn't understand math well enough to really do what I needed to do. And that was very humbling because I would call my brother up with this simultaneous equation that I was supposed to solve. And he would be like, oh, that's a trapezoid with a circle in the center. And I'm like, what? You could see that from the equation? He was like, yeah. I was like, oh, okay, so that was my lesson. That was my lesson that there are clearly things that we don't do well. And you can't force yourself. I figured I could do it, but I would never be happy. And I'd probably never be successful because I was never going to be as good as my brothers. And I just had to that part of my brain just did not develop despite growing up in this household where everybody else was talking about the Vietnam War, but we were talking about tubes to transistors changing the world. So it was a very different kind of upbringing. But I think that kind of failure early on taught me that your paths have to you can't just do what someone else has done because they said that was a good idea. You have to figure out your own path. And it may have a series of failures, and what you thought you were going to do, you may not be capable of. And you just have to then decide that you have to be in this other path. And so I took what my parents and my brothers thought was the softest science on the world, biology, and went into medicine. That was very humbling. I was irrelevant until they got diseases. And then all of a sudden, I became relevant in the household. And now I'm very relevant because now everybody's getting older. So that was a good lesson that sometimes it takes you 40 years to really be relevant in your own family, but that's what you have to accept. So I ended up in a very odd career. I ended up 3% of the women in the Army because my husband took the Army scholarship, and I did not realize that meant that he was going to be active duty military. I really didn't. All of a sudden, he's in a uniform, and at Walter Reed, and I'm like, oh. So then there wasn't an option. In order to be with him, I had to join the Army, so that's what I did. And I have to say, amazing training. Amazing leadership and management training that I couldn't have gotten in any other institution. I ended up staying 29 years. And I think it taught me the ability to lead, and it taught me how important it is to lead from the moment you have that leadership opportunity. So those of you who are in your 30s, I bet you already are in leadership opportunities where you've had an intern or you've had someone or you're a team lead. You need to start then building other people's capacity from that very moment, because as you do that intentionally, you become a better leader and you establish that ability to bring everybody together with you. And I think that I really tried to live that way. I've intentionally mentored 8 women. I'm very proud of that. What does that mean? That means that they come into my office and they sit in the desk with me. I've never had an office by myself until recently. They're always there with me so they can see how you communicate on the phone. Because women don't teach other women how to communicate with different people. And you have to talk to a 3-star general different than you talk to someone else. And you have to learn those skills, and you have to learn how to maneuver politically. Unless they hear all those conversations, they won't know how to do it. And I think we owe it to everybody and other women that we are around to intentionally mentor every day. That means they're in your space, and they're there beside you, and you're working alongside. And I am proud of every one of them. They're all spectacular. They're all going to be incredible leaders. They're all going to way surpass me. And that's going to be an incredible legacy more than anything else that I've done. So I'm thrilled to be here. I've been here all day to hear and learn from you all, but it's been really, my career is never straight. The last thing I'll leave you with, I don't understand the word no. I have never accepted no for anything that I thought was important. So I have a bit of a reputation. I am not patient at all, and I don't accept no. To me, it just means try again. It will be yes tomorrow, and it has served me very well.
We have time for some questions.
Donna, can I just add
Sure,
one thing
please.
quickly? Debbie, you don't remember this, but many years ago, we were at a conference in Senegal talking about HIV vaccine when I was an ID fellow. And you took a phone call from your son who was worried about a math test. And I believe he was in 5th grade. It was probably 1998, 1997. And, you know, I'm 53 and I have an 11-year-old, so I was a little bit of a late bloomer, but it was that example, even though we never really met, we didn't stay connected, but here you were at this high-level meeting in your military uniform, taking a call about homework. And for those of you who know me, I have taken my son with me to over 40 countries. He took his first steps in Lesotho, he said his first word in Malawi, and you know, some of that was your example. So direct mentorship, but also just learning from the women around you how to manage these things and to not be shy. You didn't leave the room to take that phone call, and I think that's very important as well.
Oh, that's great. Let me introduce yourself.
Hi, my name's Farnaz Malik. I'm an alum of the Global Health Corps Fellowship. Woohoo. Well, I just want to thank all of you for a really great panel. I actually had a question about something Ambassador Birx mentioned a little bit earlier, which was failure. I feel like right now I'm in a room of like high achievers, people who are agents of change, but we haven't really talked too much about failure and the fact that, you know, we all fail sometimes. So I was just wondering if any of you could speak to that.
Who wants to?
I'd like to take that because I think failure is incredibly important. And if it occurs earlier in life rather than later, you benefit more from it. I failed very early in life. I failed in high school. I couldn't get through anything from 8th grade to 10th grade. I struggled throughout. I actually never gave my 8th grade exam, and the principal just put me through, out of pity, I think. But it was because of an abusive teacher who treated me badly, my low self-esteem, I couldn't speak, I was all wrapped up in myself and the adolescent angst of those years. But it motivated me to try and understand what the heck was happening to me and why was I so demolished by treatment by one individual. And that's what led me to psychology, initially to clinical psychology, and motivated me to really do well and ultimately recognized, guess what, I am intelligent. Because I truly believed I wasn't, much like you, was in a family of brilliant people, and thought because I was doing so poorly in school that this is my fate. And I even said to my mother when I was in 8th grade, find me a husband, I'll just get married. And she was so smart, she, without blinking, said, what kind of a husband would you like? And I said, somebody like my father. And she said, don't you think Daddy would have liked somebody who at least had a high school education? So why don't you finish high school, and then we'll talk about it again.
Vanessa, so, you want to get into this?
Yeah, so it's just, it is, failure is very important. Just one other quick thing to say is that Engineers Without Borders, which is a wonderful organization, produces, at least did produce for a long time, an annual report on failure. And it was one of the best things I ever saw because it examined things that they had failed in every sphere and what they had learned from it. Mm-hmm. So I've been espousing that for a while now, that we should each have one.
Yeah, Vanessa?
Fear of failure is the thing that I've struggled with the most my entire life for any variety of reasons. And the thing that I've tried to remind myself, and I still have to remind myself about this all the time, is failure is critically important to actually propelling us and catalyzing us to somewhere better and stronger. And that the most important thing, you need to fail in my eyes, because if we fail, it means we're taking risks and we're pushing limits and we're not playing it safe and we're asking questions and we're out there. And I think that, it's not ever a pleasant feeling. But the thing that I've discovered through some very beautiful and massive failures in my life are that it's how you deal with it and embrace it and learn from it that matters. And if you are able to, what I call sort of fail gracefully, and it may not be graceful in the moment, but in the sense that you embrace it and you're okay with it and you hold your head up high and you look people in the eye, the respect actually that you are given in that moment for being unabashed in what has happened, I find is, and I've learned this more from example than I think that I've demonstrated, I think is really important. And I think women really in particular struggle. There's a lot of shame often that is accompanied with failure. And I'm here to ask you, to ask myself to let that go and to just go forth, because there's too many big issues that we have to solve, and we will fail on the way, but we should do it with pride, learn from it, and keep going.
Good going.
Hey, good afternoon, everyone. I am Nafisa from Mauritius. I'm sort of a globetrotter, did med school in Pakistan, and now here I'm in the US applying for residency training in internal med. First of all, I'd like to thank all of you for being such an inspiration. Especially for me at this moment when I really need that boost through application season. So my question is, how could I be a leader at my current position and a future intern like next year at my own level? I mean, throughout the process and right now without having to wait for, moving up the ladder. And also, how do I manage residency training at the same time with joining some type of global health movement, which I'm really interested in? I'd like your take on that. Thank you so much.
Who wants to take that one on?
So first of all, one thing I say to the many residents I mentor is be a really good resident. I mean, it's very important when you are in global health, when you care for the poor, that you're excellent, because you will work in places where you won't have the layers of colleagues to ask. So don't skimp on your studies, and I've seen a lot of people get so interested. So your first job is to be really good and a really compassionate, thoughtful, studious resident. But then the second thing I would say is, in the US, we have such profound and systemic inequalities, and we are on the globe. And so one way you can start to be a leader is to really be a strong advocate for your patients and really try to understand the social and historical and political determinants of their diseases and advocate for them. And you will fight attending physicians, you'll fight others who say, oh, this guy, he's a hairball. No. He's a human being who has different life story. And if you advocate for that patient, you will always be on the moral right side. And so that's a way to be a leader. And of course, there's time to engage, but I would say while you're studying, really lead with your service, lead with your relationships with patients, and bring that to light.
Yeah, that's terrific. We have 3 minutes and 31 seconds before I get the hook. So we've got our last three questions with, we'll try to do short answers. Yes.
So my name's Alan Auslander. I'm a doctoral student at the University of Southern California. And my question is that even though I love my research and what I'm doing in global health, on the day-to-day, I so often feel like I'm just not doing enough. And I was just wondering if you felt that way and how you've dealt with that throughout your careers.
Patty?
Yep. That happens. Okay, but as you said, I mean, there are different times in your career. I mean, you have to learn about doing research. But one of the things that I think we have to work together, and this is something that I learned after being in academia and then going as the head of the National Institute of Health, I think we need to create and find out ways of creating the bridges between the things that we do research and how can we impact policies at different levels. Okay? But first of all, I mean, if you're starting to do research, do it well. And then let's try to work on those bridges so whatever you do really may have an impact.
I still feel like that now. So that's a good thing to have.
It's healthy.
Because it really, you should be asking yourself every day,
Does it make
what more
any
you
sense?
could
Yes.
do. What more you could do.
Thank you.
Hello, I'm Lauren. I'm a fourth-year biomedical engineering student at Georgia Tech. And I think that we're all familiar that these gender inequities and health disparities are large systemic problems. So how do we balance making noise, fighting against the system, with trying to be political enough so that we can get into those positions of leadership and actually create top-down leadership without stepping on toes?
Debbie,
I've stepped on a lot of toes.
So have I.
But I have found that there's always a place. I just want to say, really, I've worked across many administrations. I'm working in this administration. There is always a place where you can find common ground and relate to another human being. Because in the end, that's what everyone is. And it may be more challenging at sometimes versus others, but I have found that there is always that place, and you have to find that connection. That is on you to find the way to connect. It's not on the person you're trying to connect with. So you really have to find those places.
And let's remember Jennifer Leaning's photographs and the people who really have so much less power and are still able to lead their families out of harm's way. I think we're all quite privileged in this room, and so don't underestimate your privilege.
Wonderful. Last question.
Good evening. I have a question which I believe will be pertinent to those of us who work in healthcare environments in underserved developing countries, which perhaps might be applicable also for Dr. Garcia. Through your professional journey to become a minister, how did you navigate through corruption and speaking out against human violations and injustices while knowing it could be a risk to your own safety or a risk on your careers such that you no longer would be able to promote any change in your community?
I don't think she's addressing that to me.
No.
I think that's yours,
Well,
Betty.
That's a tough one, okay? But the reality is that there are two ways in which I think you can work at a government, right? You can stay forever and do nothing, or you can do what you have to do. And that's the way I chose, okay? And so definitely one of the reasons I think the whole cabinet, and in my case as a minister, I'm not gonna be staying, is because I have been really attacking directly corruption, okay? And at some point, I have received also phone calls and visits to my house, and I had at some point some people protecting me, okay? But I believe that there is a lot of people that don't want corruption in our countries. And as you said, we could find those people, okay? And I think you have to go on. I created a system in which people could could call or could send, and so we can find out things that were wrong. We have organized crime, for example, in Peru, selling medications or services, etc. And so we have now the police investigating all those things. So, in other words, I think you have to do what you have to do because you believe on that, okay? And you will find people that really want also a world, a country, not only a country, but a world without corruption. And you have to find those people that work together with you.
Let's thank these 5 remarkable public health leaders. Thank you, everybody.